I'm Cheryl. I am an emergency nurse practitioner and ACP. I work in the Urgent Treatment Centre.
My name's Jess. I am a registered nurse at the Heron Medical Practice in Herne Bay.
My name's Alex. I'm an emergency nurse practitioner and I work in an Urgent Treatment Centre for Estuary View.
The professional nurse advocate role was developed because there was an obvious gap being met for nursing staff. Their well-being was being overlooked, and during the beginning of the pandemic in 2020, this was a role that was rolled out to ITU nurses in the acute trust. Initially it was started in midwifery services. As the pandemic carried on, it was realised that all nursing staff needed to have a professional nurse advocate to help support staff on the wards, in the community, in GP practices with their wellbeing.
This is a master's level course and it gives you the skills and training in order to facilitate a restorative clinical supervision and try and work on quality improvement within your workplace.
They teach you about an A-equip model. So that basically means that you're advocating and you are educating for quality and improvement. It was a virtual course. It ran for about 10 to 12 weeks. And it was a once a week session that generally ran for the morning, and they take you through kind of coaching, improvement, restorative clinical supervision, so you learn all the skills you need. It's a university based course, so it's a level 7 module.
In order to complete the module, I had to do a poster in order to sort of present what I felt that the P&A role implemented within my workplace, and I also completed a portfolio which evidence that I'd been doing restorative clinical practice and that I had met the A-equip model.
At the end of 2020, myself and my colleague Alex noticed that there was a steep decline in the health and wellbeing of our staff, and people were really starting to feel the impact of it. So we just got together and started doing some wellbeing practices, and then we realised there was a formal way that we could have this introduced into practice via the P&A programme.
The interest in helping colleagues with burnout and stress has really been a passion of mine. So to be able to do something formal has solidified my passion for that.
So the project that I did when I was studying for my professional nurse advocate qualification was gratitude journaling. So the idea of that was that we came in every morning into a morning huddle and we wrote down 3 things that we were grateful for, and we put them in a jar. And we would share just one of those things that we were grateful for. And prior to the journaling, I did a Survey Monkey to ask some questions, and then I repeated that at the end of the month to see if there was any improvement that the gratitude journaling showed us. It showed quite a significant change in the way that people were perceiving their days. So prior to the gratitude journaling, people were feeling tired and stressed, and they were feeling that they couldn't cope with their workload. And a month after the gratitude journaling, it actually had jumped up by 53%.
I've become heavily involved in education and development for our kind of junior clinical staff, so our healthcare assistants, and some of our reception staff have kind of developed up. So I've kind of taken on that mentoring role with them, and I meet with them regularly to see where they want to be, what skills they want to develop. And I'm also now pushing that out to non-clinical staff. So we're looking at kind of workforce retention for our reception, because it's always a huge turnover. So we're looking at kind of implementing a good structured programme for them, so that they feel valued and that they want to stay. We're trying to make a practice where people want to stay and want to work.
We have been allocated 2 hours per week in order to complete our role as a professional nurse advocate. So I embed the nurse advocate role into my practice daily by taking note of staff welfare during the day. We implement a morning huddle which encourages staff to be open and honest within their workplace. They are aware of the support they have within the workplace. They know how to access the restorative clinical supervision.
I currently have 1 morning a week at the moment, which I am free from clinical practice to either, and it may be that I use that morning with staff who are training, who need support in their training endeavours, but also if I'm not doing that I get the opportunity to kind of come in and sit in with the staff and liaise with them, and then I can use that time as well if staff want to come and see me and they have any issues.
I would really encourage anybody who is interested in their own wellbeing as well as others to take part in the Professional Nurse Advocate module. This is funded by the government and it encourages you to think about your own personal growth as well as improving the place that you work for.
Instilled in me what type of leader I could be, how I could use the skills that I already had to bring kind of all of this change into the practice. It kind of made me feel like I was a bit more approachable. It made me look at things in my kind of emotions and stuff that made people maybe not want to come and see me.
But anybody that's interested in leadership and management, it seems to be a natural progression to help support staff in a more holistic way. Overall, I think we've had a really good response and it's having a positive impact. So I don't think I would have any doubts about anybody going forward.